What's the best prenatal vitamin that you should be taking? Well, unfortunately, if you're only following the recommended dietary allowances, or RDAs, given out by places like the Institute of Medicine or ACOG, you might be putting your pregnancy and your baby at risk for deficiency and complications as well. So in this video, we're going to go over what nutrients you really need, what they're for, and what the newest research is saying about the optimal dosage that you should be getting to prevent pregnancy complications and health risks in your baby. And stick with me to the end of this. I'm going to share a checklist that you can go through to make sure you're buying the best prenatal you can get. The first thing to understand is that the recommended dietary allowances, or the RDAs, are outdated and insufficient. And if we only follow those guidelines, we are putting ourselves at risk for deficiencies, pregnancy complications, and health problems in our baby. These will eventually need to be revised to be more in alignment with current research because some of these things are absolutely insane. Some vitamins we'll talk about have RDAs that are 10 times or more below what new research is showing we need. RDAs were also put out specifically to help reduce severe deficiency and not necessarily for optimal health. These were also mainly set after looking at studies that involved only men. And then they kind of guessed at how much they needed to increase that by for a pregnant woman. RDAs for pregnant women are pretty much just a guess at best. So you might look at the back of a prenatal label and say, oh my gosh, this has 100% of the RDA for something that I need. But don't be fooled by this. We'll go over what you really need and in what amounts. The first nutrient we'll talk about is vitamin D3. This is necessary for reducing the risk of preeclampsia. It supports immune function and is necessary for proper development of the baby's bones, brain, nervous system, muscles, and so much more. The RDA set for this is only at 600 IU per day, but this has been looked at in studies and found to be insufficient. Many studies are suggesting that 4,000 IU per day be set as the proper maintenance dose. Vitamin D deficiency in pregnancy does put you at higher risk for preeclampsia, gestational diabetes, and it can result in lower birth weight babies or preterm birth. Deficiency is also extremely commonly found in newborns, with some studies finding that 50% or more newborns are born vitamin D deficient. This is even in the presence of the mother supplementing already with the RDA of 600 IU per day. So this RDA is just insufficient at preventing deficiency both for mother and baby. You should have your personal vitamin D3 levels checked, and you should be aiming to have your level above 50 nanograms per mil or 125 nanomoles per liter, depending on what unit you use. I recommend that your prenatal should have at least 1,000 IU in it and up to 4,000 IU in it. But you should supplement on top of that with a separate D3 and K2 combination supplement up to what your blood level needs. We want to get you to that 50 to 70 nanograms per mil level, so we need to supplement on top to get you there. Let's look at iron. You need iron to support the massive increase in your blood volume during pregnancy, as well as support the placental development and growth of baby. Your iron needs are much higher in pregnancy than when you're not pregnant, so this is something that should be routinely checked at your doctor's office to make sure that you're not deficient or anemic. The RDA for this is 27 milligrams per day, but it's likely you need closer to 45 milligrams or a little bit more per day. That being said, I generally recommend that we get our iron from food and not necessarily from our prenatal. Most iron is not well absorbed, and it can cause a lot of nasty side effects. These side effects make it difficult to continue taking your prenatal, and a lot of people just ditch the prenatal because they can't stand the side effects of the iron. The absolute best way to get enough iron is from your food. And if you can't get enough from your food, then we can supplement, but we'll supplement in a much easier form. A form like iron bisglycinate is much easier to absorb and doesn't come with all those nasty side effects. The best food form of iron is heme iron. And this is going to come from your animal sources like chicken, liver, beef, oysters, sardines, and wild salmon. Iron sources from animals is better absorbed than non-heme iron from plant sources, but you can get some non-heme iron from things like beans, lentils, whole grains, and dark leafy greens. So you do not have to get a prenatal with iron in it. And in fact, I'd prefer it if you don't get a prenatal with iron in it so that we just avoid all of those side effects to begin with. You'll get things like nausea, constipation, or heartburn. And again, it can just make it hard to take your prenatal. We really want to focus on getting this nutrient from your food first, and then if we're showing signs that our iron is low or we're anemic from your labs at your doctor's office, then we start to supplement on top of that with a really good form like iron bisglycinate. All right, let's look at B12. This is a super important one. This is needed for the creation of new DNA and proteins and supports the baby's neurological development, including the formation of the neural tube. A deficiency in B12 can be related to not only having trouble getting pregnant, but a deficiency in pregnancy can lead to anemia and increased risk of preeclampsia in mom. And for the baby, it can result in neural tube defects, intrauterine growth restriction, and increased susceptibility to chronic diseases, including insulin resistance. A B12 deficiency is not common in the general population, but it is more commonly found in pregnant women or vegans and vegetarians. On top of this, the RDA is set too low at only 2.7 micrograms. There was a clinical trial that was done on pregnant women who consumed 7.8 micrograms of B12 per day, and they were only able to keep their B12 levels on the low end of normal. So this recommendation of 2.7 mics is just way too low. And you should not only be having enough B12 supplementation in your prenatal, but you should also be having some good food sources of B12. Animal foods like meats, seafood, dairy, and eggs are the only foods that have true vitamin B12. Plant foods like algae and kombucha have an analog of B12. This analog takes up a B12 receptor site and cannot perform the function of true B12, especially in the methylation cycle. This can result in a vitamin B12 deficiency that gets masked in labs because labs cannot differentiate the difference between true B12 and a B12 analog. There are lots of foods that are fortified with B12 too, so that will contribute to your overall intake of B12. Just check the labels of the things that you're buying. You should be making sure that your prenatal has at least 8 micrograms of B12, but you'll notice there are so many that contain well above and beyond that, which is 100% fine. Your body will take the excess out, and it's generally very safe to take very high doses of B12. Also, make sure the form of vitamin B12 that you're taking is not cyanocobalamin. This is not easily absorbed, and it requires your liver to remove the cyanide molecule, which then needs to be detoxified, and we just don't need cyanide in the body. Something that's really important to make sure is in your prenatal in the right form and in the right amount is folate. Folate is a critical player in your methylation cycle, which needs to work well for DNA synthesis, gene expression, cellular function, and in the baby, it supports neural tube formation, brain development, and healthy cell division. A lot of controversy over the form of folate, whether it's folic acid or 5L-methylfolate. I will need to do a longer, deeper dive on this at some point, longer than I've already done. But to go over it really quickly, there are really great studies that have been done confirming that the folic acid form of folate does prevent the majority of neural tube defects. These are defects that result in spina bifida or problems with brain formation. These studies confirmed this all the way back in the 1990s. This then resulted in folic acid being added into a bunch of foods to fortify them. So foods like your breads, your pastas, your cereals, these all have extra added folic acid in them to help prevent neural tube defects because most people were found to be deficient in it. Now, folic acid is a very stable form of folate that gets absorbed really easily into the body. But there are many people who can't really absorb that form very well or convert it. But there are many people who can't take that form and convert it very well or in the amounts necessary so that it can actually be used inside the methylation cycle. These people have a gene variant in their MTHFR gene. And while many practitioners will claim this has nothing to do with it, it shouldn't even be tested and all sorts of things, people with this gene variation result in high homocysteine levels and poor methylation, which are both associated with higher rates of infertility. Not only issues in getting pregnant, but also a higher risk of miscarriage and bad pregnancy outcomes. More and more newer data is suggesting that women and men who do struggle to get pregnant or do have infertility struggle also are more likely to have an MTHFR gene variation. In one study, a group of 400 women who were using assisted reproductive technology were tested for the MTHFR gene variation. And it was found that 79% of them had at least 1 or 2 copies of the C677T MTHFR gene variation. So it's really close-minded, in my opinion, that even though we know folic acid does work from all of these research studies done 30 and some 40 years ago, that means it works uniformly for all people in all instances with 0 caveats whatsoever. There are cases where even women who do not have gene variations in their MTHFR gene also have higher homocysteine levels and difficulty getting pregnant when taking folic acid specifically, which then resolves when they switch to taking the L-methylfolate form. In what I do, I'm dealing with women who have been trying sometimes for many, many, many years. And usually they've been disregarded in almost every single office they've been in. I do find elevated homocysteine levels and other markers of poor methylation even in women who do not have any gene variation in their MTHFR gene. So the success that I see in blood markers, health markers, sperm analyses, and pregnancy rates is why I recommend that your prenatal have the L-methylfolate form in no less than 800 micrograms. So you'll supplement in your prenatal with 800 micrograms of L-methylfolate on top of the food folate that you're eating through leafy greens and vegetables. The next nutrient we'll discuss is choline, and this one is extremely important, just as important as folate, but has received a fraction of the attention that folate has gotten. This is necessary for fetal brain development, memory, even into adulthood, and it's critical for the closure of that neural tube. The RDA for this is only at 450 milligrams. But this is not only already too low, it's found that 94% of pregnant women don't even meet that already too low level. More current research is showing that pregnant women need closer to 930 milligrams of this per day. And this is based on some really good quality randomized controlled trial data where they actually compared different rates of supplementation of choline in pregnant women, and they looked at pregnancy health and baby outcomes. The best foods containing the highest amounts of choline include egg yolks, liver, and organ meats, and only about half of the people who eat eggs will meet that low RDA of 450 milligrams per day. If you're vegetarian or vegan, you can get choline from shiitake mushrooms, beans, legumes, broccoli, tofu, but the amount that you'll need to eat is extremely high. So if you do eat eggs or you're able to eat eggs, it's very highly recommended that you add that in to make sure you're getting enough choline per day. I do recommend that you get a prenatal that has at least 200 milligrams of choline in it, and then you really need to make sure you're eating foods that contain choline in them. If you're not someone who's eating choline-rich animal foods, then it might be a good idea to get a separate choline supplementation on top of that prenatal as well. Let's talk about DHA or your omega-3s. DHA is crucial for proper eye and brain development. And this is something you must get either through your diet or through supplementation. And ideally, you'll be doing both. This is not something your body can create itself, so you have to take this in. The minimum for this should be 500 milligrams per day. But studies show that children of women who supplemented with higher levels of up to 2,200 milligrams per day had better hand-eye coordination test scores. You can get all the DHA and omega-3s you need through eating 2 to 3 servings of fatty fish per week. But if this is something you can't do or don't do, then supplementation is best. Fish is an incredibly nutrient-dense powerhouse food. Not only does it have DHA and other omega-3s, but it has tons of other vitamins and minerals. Unfortunately, some women are told not to eat fish when they're pregnant or when they're trying to conceive because of the mercury levels that could be in them. But this disregards the fact that these fish that you're usually buying and eating in the grocery store have high amounts of selenium in them. And selenium binds to mercury and doesn't allow it to be absorbed in the human body or cause any damage. I'll have to do an entirely separate video on this, but fish like salmon, trout, sardines, haddock, and many, many more contain low mercury and high selenium levels. All of that being said, if your prenatal has some DHA in it, that's great. Make sure it has about 500 milligrams of it. If it's got EPA, that's even better. But if you can't or don't have it in your prenatal, then you can eat fish to get that DHA and other omega-3s, or you can supplement with something separately. Let's talk really quickly about zinc. This is really important for immune function and fetal growth. And a deficiency in zinc is linked with neural tube defects, preterm delivery, low birth weight, and miscarriages. The RDA for this is 11 milligrams, but studies show that pregnant women need closer to 15 to 20 milligrams. There's lots of disagreement here on form, but that will have to be a totally separate video. But zinc bisglycinate is the best form. And ideally, your prenatal should also contain a little bit of copper so that the extra zinc doesn't cause a copper deficiency. All right, let's talk about iodine. This supports thyroid health, and it has a lot to do with ovarian function, so this is important if you're having any fertility issues or miscarriages. This supports thyroid function and brain development in baby, and some studies looking at iodine deficiency in pregnant women have found that it is related to higher risk of preeclampsia, intrauterine growth restriction, and preterm delivery. We need iodine for our thyroid hormone function, which is 50% increased during pregnancy. There are 2 separate RDAs for this in the USA, but most people aren't even hitting that low level of 150 micrograms per day, let alone the higher value of 220 micrograms per day. As per usual, the RDA for this is also too low. I recommend that you get at least 250 micrograms of iodine in your prenatal supplement. And then you should also be eating foods that do contain some iodine, like seafood, dairy, eggs, seaweed, beets, and of course iodized salt. I hope all of that was helpful and useful. Definitely hit me in the comments below if you have any questions. In terms of the checklist to make sure you're getting the best prenatal you can get, the first thing is you want to buy from a reputable brand or company, and preferably one that has third-party testing results available. This is to make sure that there's no contamination inside there and that actually contains the amount of vitamins and nutrients it says it contains. Number 2 is that it should be either a capsule, a pill, or a powder. Generally speaking, gummies do not have the amount of nutrients in them that we need, and even what's on the label is not what's being found inside the gummies themselves. Number 3 is to check for the minimum amount of the nutrients that we talked about before. One really great and fast way to do this is to just start by looking at the vitamin D3. If you see that the vitamin D3 only has 600 IU in it, you can be pretty much guaranteed that vitamin brand is only going off of the RDAs alone and not looking at any of the research for what women actually need when they're trying to conceive or pregnant. Number 4 is to check the forms that are being used, especially for B12 and for folate. We definitely don't want any cyanocobalamin inside your prenatal. And number 5 is don't put this too high up on a pedestal. Get the best you're able to get, and remember, this is supposed to supplement a really awesome, nutritious diet. Definitely check out some other videos on my channel all about diet for pregnancy and for trying to conceive, and I'll see you in the next video, ladies. Bye.